I want to make this presentation on alcohol, and I'll begin by letting you know that this is not exhaustive. You must have made research on your own on many occasions through many different sources, but the main issues will be pointed out here. Okay, let's go. Yeah, the minor manifestations of alcohol withdrawal are anxiety, become anxious, agitation, become restless, can't sleep, tremor in the hand, tremor everywhere, sweating profusely, the heart is racing, there's headache, and of course, we'll start craving alcohol, and there'll be loss of appetite, nausea, and vomiting. Severe withdrawal effects are hallucinations in the first 12 to 48 hours. These hallucinations will present in form of visual hallucinations, seeing strange things that the rest could not see, auditory hallucinations, hearing voices that no one else could hear, tactile hallucination, feeling that something is crawling over the body, like inside is crawling, and of course, in the first 6 to 48 hours, there could be seizures. There could be seizures. And in the next 48 to 96 hours, there could be delirium tremens. I'm going to talk more about delirium tremens in a bit. Delirium tremens is characterized by delirium. You become confused, hallucination, like I said, you become agitated, can even be on hospital bed, might be you've had some alcohol, about 48 hours ago, you are now admitted in hospital, you even had surgery done, nobody knew, or lie has been told to the doctor and nurses, but then 48 hours after, start become confused, telling nurses I could see this, I could hear this, I feel something moving over my body, pulling out, IV line, not wanting to remain on bed. And when they take the vital signs, the BP is up, the heart rate is up, the temperature is up, and this patient is sweating profusely. And the next thing is ask family members, ask this man, ask anyone, has he been taking alcohol before? You're going to get it. Then you are dealing with delirium tremens. CIWA is what we use to find out the level in this person, and there's CIWA revised version right now. So the nurses will ask, it's a prepared questionnaire. The nurses will ask whether you have nausea and vomiting, any headache, paroxysmal sweat, auditory disturbances, anxiety, tactile disturbances, tremor, orientation and clouding or sensorial, maybe you are just confused. If all the points you score is less than 10, then it's a very mild withdrawal. If it is between 10 and 15, it's mild. If it is 16 to 20, it's moderate. But if it's greater than 20, it's a kind of severe withdrawal. The blood will be taken for complete blood count, for glucose, for liver function test, for toxicology, particularly alcohol level, urine drug testing, because people who are drinking alcohol may be doing other drugs, electrolyte like potassium, magnesium, phosphate, sodium, calcium, and the likes, renal function tests, amylase and lipase, and sometimes, depending on the presentation, the doctor might choose to do CT of the head. to rule out other possible cause of seizures, because sometimes people, seizure will be present. They will likely screen you for other drugs, like heroin, codeine, morphine, buprenorphine, oxycodone, methadone, fentanyl, and if you are older than 50 years, EKG will be done. If you have watched representations on these opioids and the likes, you'll get a clearer picture. The treatment is called a kind of supervised alcohol withdrawal treatment. Here, benzodiazepine is used, and long-acting one like chlordiazepam is used. Chlordiazepam is now gaining ground. No, it's been around for a long time, but less people are now using diazepam. You can use oxazepam, lorazepam, or even gabapentin at very high dosage. Then thiamine will be given for the first 3 days. As a matter of fact, you start with thiamine before you give a glucose. Then diazepam is fading out because of the risk of developing the physical dependence, and the withdrawal symptoms if it is abruptly withdrawn. Carbamazepine is used in Europe for alcohol withdrawal now. As far as alcohol is concerned, a majority will use it wisely, and they are safe. Men, 4 standard drinks per day with 2 alcohol-free days per week is regarded as low risk. For women, 2 standard drinks per day with 2 alcohol-free days per week is regarded as low risk. It has a lot of effects on cardiovascular system and causing so many cardiovascular diseases. There's possibility of cancer of the rectum, of the colon, or you combine it together as colorectal carcinoma. Increases the chances of oral cavity cancers, larynx, liver, and esophageal carcinoma. Other effects are that it causes pancreatitis by increasing triglycerides level and other mechanisms, and also hepatocellular carcinoma, lung cancer, liver cirrhosis. I've seen a lot of elderly people, mostly men, and women are not exempted anyway, coming down with liver cirrhosis after long years history of alcohol intake. Osteoporosis is very common, and there's an entity called alcohol dementia. Alcohol dementia is not a true dementia, but there will be problem thinking, and there will be problem with memory. And of course, diabetes mellitus. As a matter of fact, moderate alcohol increases the blood sugar, but excess alcohol would decrease the blood sugar, and it affects the medication you're going to take to control your diabetes, insulin, and the rest. When you take alcohol, the police will not smile at you when they check your alcohol level and it's very high, because it's likely you cause road traffic accidents more than those who don't take, because you become impaired. Disinhibition, you don't even think right anymore. You can do any stupid thing. That's why violence will increase. There's disinhibition, just do stuff, no proper judgment anymore. And the rate of suicide will increase if the individual is also taking alcohol, ethanol, and the like. So to stay safe, Keep away. For women, alcohol and hormone replacement therapy. It is worse for any woman that is on hormone replacement therapy and is taking alcohol. Please be advised. It increases the possibility of gastrointestinal tract carcinomas. Those ones are related just now. And of course, female breast carcinoma. So, premenopausal, menopausal women taking hormone replacement therapy, please keep away from alcohol. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome has acute phase, which will be Wernicke's encephalopathy, and chronic phase, which is the Korsakoff psychosis. This is as a result of decreased thiamine, and there will be profound memory impairment. Decreased thiamine might occur in poor diet, malnutrition also, but is pronounced in alcoholic people. Well, the brief conclusion here, because alcohol is such a subject that you cannot just make a 10 minutes presentation and tell anyone you are done. But for this moment, I could remember the slogan in those days. I don't know whether it's still on. If you drink, don't drive. If you drive, don't drink. So many countries, so many jurisdictions will not prohibit alcohol intake, but then keep away from other people. No, don't start driving when you are drunk, or you even have the bottle in your vehicle and you are driving and you are drinking. Road traffic accidents. Stay safe and don't kill anyone else. Thank you for watching my presentations. I'm going to make more in future about alcohol. It's just the part one of it. So if you drink, don't drive. If you drive, don't drink. Thank you.